Good morning, it's Dr. Malcolm Ulala. I'm joined here with our patient, and our cosmetic nurse injector Sophie is going to give me a hand today. Our patient today, we are going to do a very simple treatment. We're just working on the scarring, and today I'm going to put some nano fat into the area located in this area. Now, this was an area where there was a very aggressive basal cell carcinoma. It was excised, the margins were still very close, so we referred him to the Gold Coast Hospital, who have done an amazing job taking hair, bringing it around the side and recreating an eyebrow, because you could imagine that there wouldn't have been anything here, and they had to perform a small skin graft at the top. Now, we've been working on that to revolumize the defect, and it's come up quite well. Today I'm going to use his own natural stem cells from his fat, which I'm going to harvest to put into the area. It's a very quick procedure, this kind of harvesting of fat, and we can use it for multiple things. We can treat scarring, we can treat lines and wrinkles with it, lip augmentation, full global pan-facial rejuvenation with nanofat stem cells. And it's a procedure that can be done in a small procedural room. It's done under local anesthetic, it's not painful, and is your own natural regenerative miracle cells that are going to do their work. If you could just lie down for me. Just turn onto your right side. Left, yeah, your right side. Sorry. No, other way. You're using it. Okay, so I've put the local in. I'm just going to harvest the cells from this area, and then I'm going to just wash them with some saline, mix it through a microaggregation filter, and then just re-inject it into the area. Thanks. Okay, so we're ready to go. I'm just doing we've cleaned and draped the area, it's sterile. I've got sterile gloves. We're just making an entry point here. He's got local, you don't feel any of this. There are many different fat harvesting cannulas you can use. Can you just pass me a scalpel there, please? Green one. And this just is going through the skin. There you go. We're going to go into the entry point now. We're going to be in the right plane to harvest the fat. It is in. We apply negative pressure on the plunger. And what I'm going to do now is just gently harvest the fat that I want. And as you can see, we're starting to get some fat coming through there. Now, the patient doesn't feel this because we've already numbed the area up. And this is basically, if you were doing liposuction in a bigger area, this is principally what we do. We put in a solution of diluted local anesthetic called tumescent local, and wait for it to work, and then we do the procedure. Okay, so this is our nano fat. This is our fat that we've harvested, and we're just going to stand it upside down, and we'll find the local anesthetic will go to the bottom and leave the fat on the top, and we will just clean that up and then inject it. All right, so we've harvested the fat, probably got about 10 mils of fat. I'm going to further disaggregate that fat. What we've got here is just the local anesthetic and the red blood cells which are precipitated, and we've got the fat on the top. So I'm going to let this out, put it together, then I'm going to disaggregate the fat and make it into nano fat, and then I'll be starting my injection. And it's really just like a filler injection that we're doing. This is to improve the scarring. It helps with the texture of the skin, and he has, from the surgery, he has had on this side, there's quite a bit of loss of volume there, so we'll be coming in and just recontouring through there also. Okay, so here I've got the beautiful miracle stem cells. I've disaggregated them, and now I'm basically putting them into like a filler syringe, so to speak. And I'm going to use deposit small parcels of these into the tissue to stimulate regeneration. This is, we do this on the hands. It's very good for the hands, and it's your own product, like I said, and you can do it globally on the face as an anti-aging. It's far better than PRP. All these are available, but remember, with fat you've actually got stem cells, or I call them miracle cells, within your own body. PRP only has growth factors. It doesn't have the exosomes and the adipose derived stem cells that are present. Okay, so we've got this here, and now I'm going to start the procedure. Okay, this is exactly the same cannula that we use with filler. It's a blunt cannula, so there's less risk of intravascular injection. Using a cannula, certainly a larger cannula, is a 22 gauge. With a cannula, we just make an entry point. There's local here. There you go, hold that. Okay, ready? Right, so what we're going to do is just put our cannula in here. It's a blunt cannula. Sometimes you've got to just create a bit of tunneling, because don't forget there's scar tissue here. There you go. This is exactly what I would do with filler. We have actually lifted this area up with filler before. So I'm just going to gently just work this in through the scarring. There we are, underneath the scar, and it's very tough. I may even have to just go to a blunt cannula, there we go, to hydro dissect possibly. There we are. Okay, so the tip of the needle is there, or the blunt cannula is there, and now the nano fat's just going to go in here. This is beautiful enriched stem cells. Nano fat and stromal vascular fraction are incredible for scarring, and some of the people that do a lot of this overseas have had amazing results with significant scarring using nano fat. Okay, this will go down, so I'm going to slightly overfill this area and just get into that corner now. He felt that a bit, sorry. Yeah, so right at the apex there. There we go. We're just going to fill this up. And then I'm going to go a bit deeper, but I think I'm going to go with a needle because there's just too much scarring. So I'm going to get right into that scarring underneath here with a sharp needle. Okay, that's great. All right, so we've got a little bit of fat coming out there, but we're just going to mold it around. And that's come up beautifully. I'm just going to put a little bit deeper into the scarring, just up there. So I'm going to fill in this area here where we've lost a lot of volume there. This is always a very dangerous area, and this is not to be done by anyone except a doctor, please. Very dangerous area. I'm actually going to go here underneath the muscle. On the bone. You can see that coming up beautifully. A little bit underneath the eye, just coming underneath the muscle there. You can see that's popping that up beautifully. And then just a little bit into that corner there. I'm going to do here for our client is a couple of things. We've got some filler and we're going to give him spoil them a little bit. There appears to be a little bit just in that area there.
I have about 6.5 mils.
Yeah, so we'll just use 2 per side. I'm right on the bone there. Okay, so what we're going to do is just give him a little bit of regeneration with the leftover stem cells. Just can I just have a syringe, please?
With what in it?
Whatever. No, just to create an entry point here, please. Needle. It's a needle.
Introduce it then,
Okay. Just get another syringe ready, please. So I'm going to just build up the submalar area here as well for him. Oh, the cannula bent. Okay, so we don't have a track. Another new cannula, please. 22 gauge. So once again, cannula, fat. It could be a filler syringe with hyaluronic acid. But hyaluronic acid doesn't have the regenerative capabilities of nano fat. So like I said earlier, sometimes it can be a bit tough, the skin, and you're trying to get these blunt cannulas in. It's a little bit awkward, so you've got to create a channel. Do you have any pain at all, or I'll need a 19 gauge in here. You're right, it's very tough.
A 19?
Yeah. Okay, so what we would do if we were contouring with filler, yes, you would inject deep on the bone. Can I just have some gauze, sterile gauze, please? Yeah. You would inject some deep, high viscosity filler if you wanted to lift the bone. That's not the purpose of this type of fat. We are injecting microaggregated fat for regeneration. We're not injecting microfat for volumization. That's a different process altogether. Can I have another syringe, please? So this is a process that we use. It's literally in the hypodermis, and we just gently retrograde all of this beautiful miracle cell solution into his face. And the beauty about this is generally there are no side effects, no risk of a biofilm developing like can happen with hyaluronic fillers, and is that you can get a bacterial biofilm. These little miracle cells are like an army. They go to work straight away, all right, once they've settled and they've found their home, and they start building up collagen and strengthening the extracellular space, which is in fact part of where we harvest some of these cells. And it is the extracellular space that is actually probably one of the most important areas of skin renewal, skin regeneration. Okay, how many we've got left?
We've got four and about half mils. 4.5.
Okay. So yeah, we're just going through here, just giving him these beautiful, glorious miracle cells. People, you know, what you've got to realize is that we have the capacity now in many stem cell centers to harvest medicinal or mesenchymal stem cells and culture those to treat all sorts of neurodegenerative conditions. This is what it is. So I don't think people really understand just how powerful your own natural stem cells are. How many got left there?
After this will be 3.5.
Okay. Right, so that'll do through there. It's got a low orbit there. We can do that. 3.5, is it?
Mm.
Just leave that. Okay, little stab now. Can I have a cleaning solution?
Mm-hmm.
It's done, particularly in younger people or people in general that have had nanofat in in their kind of nasolabial folds, it stays around for a long time, years. So that's very different to fillers. Sorry, bear with me, just a needle. So we're just going to go up in the actual fold, in the crease, and we're just going to inject all of this beautiful stuff. We're not going to do his lips today, but he's going to come back next week for lips. Just relax. And get right up there, and we're just going to deposit that in there. Okay, so we're going to come to the other side now. Okay, so this is a filler going in, a nano fat filler. Obviously, men have much tougher skin, and the cutaneous ligaments here are very strong. But he's quite comfortable, you know, his knuckles haven't gone white. Just working through the submalar area now. Now this one is mainly water, so that's no good. Is it? That's all right. So we'll just go back to there. Submalar area, yeah, that feels better. Now where I'm passing through this cannula, it doesn't have any local anesthetic. Exactly same with the filler. We don't need to put local anesthetic in all around his face, but he has got a little bit in the entry point. Okay, so we finished the procedure.